Hi, Theresa. How are you today?
Oh, I'm feeling pretty good, but I was told by my oncologist that the medication I'm on to treat lung cancer might cause skin toxicities.
Yeah, that's a great point. The medicine that you're receiving belongs to a class of cancer treatments called EGFR inhibitors, and they are known to be associated with dermatologic toxicities. So let me tell you a little bit about them. Rash happens in a majority of patients on this class of medicine. It usually presents as an acne type of rash with pimples, and these usually occur on your face, also your scalp, chest, and your back. In addition to the acne rash, patients can have dry, itchy skin, and on occasion, nail infections can also occur. Now, while these rashes happen in a majority of patients, there's a lot of things that we can do to help really prevent and also to make them mild and help to reduce the severe rashes.
Are these skin toxicities preventable?
Yes. So things that we can do to help reduce the severity include having patients use a lot of moisturizer on their skin to prevent the skin from becoming very dry and cracked. This is really important, especially on the hands, which can develop cracks as well. We can also provide patients with medications that they can use to help prevent the severity of the rash. So, for instance, we can prescribe topical medications, topical steroids, and in addition, we can provide oral medications, which are antibiotics. And these medications, in addition to moisturizers and reducing sun exposure, will help prevent the severity of the rash.
How do I look for signs of skin toxicities and when should I call my doctor?
So you should check your skin regularly while you're on the cancer treatment, and you would notice if a rash develops because you would see itchy bumps on the skin or pimples develop on your face or your chest or your back, or you might notice your nails feeling a little bit inflamed, or if a nail infection were to develop, they would be red and sometimes pus would occur as well. Usually the rash happens after the first week or so onto treatment. Some of the other side effects can take a little bit longer to present, including the nail infections. Those can occur sometimes after a month or so, or even later on.
How do you treat these skin toxicities if they do occur? Who typically manages them, dermatologists or oncologists?
That's a really great question. So we're a multidisciplinary team. So oncologists and dermatologists work together. The oncology team will be evaluating you quite regularly and checking in, and they can certainly begin your treatments should you develop any skin problems. If the skin toxicities become more severe, then a dermatologist would see you and would help manage it. And the strategies that we typically use include topical medicines, either antibiotic or steroid creams, and these can be quite effective, as well as oral medicines such as oral antibiotics. If patients develop a severe rash, then we can use oral steroids, which are very effective in reducing the severity of the rash. So we have a lot of treatments at our disposal to ensure that your rash will remain low level and it's not going to negatively impact your quality of life.
How long does it take for skin toxicities to resolve once treatment is started?
The rash, when it's treated, usually improves over a time range that could be days to sometimes a week or so. And then regarding the nail infections, those can take longer because the nails grow very slowly. So nail infections can resolve over the course of weeks to even sometimes a couple of months. But I think a key take home is by treating these rashes and other skin toxicities and dermatologic toxicities early on will improve your quality of life and will enable you to remain on your cancer treatments.
Thank you, Dr. Levanthal. I have a better understanding of the skin toxicities that may occur because of my medication for lung cancer.
Thank you, Theresa, and thanks to our audience for listening.